Polycystic Ovarian Disease, also known as Polycystic Ovary Syndrome, is a common hormonal disorder affecting women of reproductive age. It is characterized by an imbalance of hormones, leading to problems with ovulation and the development of small fluid-filled sacs in the ovaries. Many women with PCOD may not even realize they have it until they experience difficulties conceiving or develop other symptoms. PCOD is not a single disease, but rather a syndrome, meaning it presents with a cluster of symptoms that can vary greatly from woman to woman. Some women may only have a few mild symptoms, while others experience more severe and debilitating effects. This hormonal imbalance can have a significant impact on a woman's menstrual cycle, fertility, and overall health. It's important to remember that PCOD is a manageable condition, and with the right information and support, women can live full and fulfilling lives. Understanding the complexities of PCOD is the first step towards effective management and treatment. With greater awareness and access to accurate information, women can take control of their health and well-being. The symptoms of PCOD can vary greatly from one woman to another. Some women may only experience a few mild symptoms, while others may have a wider range of more severe symptoms. One of the most common symptoms is irregular periods, which may be infrequent, prolonged, or completely absent. This irregularity is often due to the lack of ovulation, as the ovaries do not release an egg each month. Other menstrual irregularities include heavy bleeding or spotting between periods. Another common symptom is excess androgen production, which are male hormones typically present in women in small amounts. Elevated androgen levels can lead to symptoms such as acne, hirsutism, and male pattern baldness. Weight gain, particularly around the abdomen, is also frequently associated with PCOD. This weight gain can be resistant to diet and exercise due to the underlying hormonal imbalances and insulin resistance often seen in PCOD. Other possible symptoms include fatigue, mood swings, sleep disturbances, infertility, and thinning hair on the scalp. It's important to note that not all women with PCOD will experience all of these symptoms, and the severity can vary significantly. The exact causes of PCOD are still not fully understood, but it is believed to be a combination of genetic and environmental factors. Hormonal imbalances and insulin resistance play crucial roles. Genetics also contribute, as PCOD tends to run in families. Understanding these factors can help women make informed health decisions. Diagnosing PCOD can be tricky, as there's no single definitive test. Doctors use a combination of your medical history, a physical exam, and specific tests. First, they'll ask about your periods, weight changes, and any difficulties getting pregnant. They'll also inquire about symptoms like acne or excess hair growth. During the physical exam, they'll check for signs of excess hair growth, acne, and insulin resistance. They'll also perform a pelvic exam to feel for any abnormalities in your ovaries. Your doctor might recommend blood tests to check your hormone levels. These tests measure levels of hormones like testosterone, follicle-stimulating hormone, and luteinizing hormone, which are often imbalanced in PCOD. An ultrasound, usually a transvaginal ultrasound, might be performed to visualize your ovaries. This imaging test can detect the presence of cysts on your ovaries and assess their size and number. It's important to remember that PCOD can sometimes be mistaken for other conditions, so a thorough evaluation is crucial for an accurate diagnosis and to rule out other potential causes of your symptoms. Section 5. Lifestyle modifications taking charge of your health. Managing PCOD involves lifestyle changes. Healthy habits impact symptom management. Maintain a healthy weight. Even small weight loss helps. Focus on a balanced diet. Limit processed foods and sugary drinks. Regular physical activity is crucial. Aim for 30 minutes of exercise. Exercise improves insulin sensitivity. Stress management is essential. Stress worsens symptoms. Incorporate stress-reducing techniques. Section 6. Medication options, restoring hormonal harmony. In addition to lifestyle changes, medication is often recommended to manage the symptoms of PCOD and address specific concerns. The choice of medication depends on the individual's symptoms, severity, and whether they are trying to conceive. For women not actively trying to conceive, birth control pills are often prescribed to regulate menstrual cycles, reduce androgen levels, and improve acne. Birth control pills contain hormones that work by preventing ovulation and reducing the production of androgens in the ovaries. Metformin, a medication commonly used to treat type 2 diabetes, is also prescribed for PCOD. Metformin improves insulin sensitivity, which can help regulate menstrual cycles, reduce androgen levels, and aid in weight management. Other medications that may be prescribed include anti-androgen medications, which specifically target the effects of excess androgens, and medications to induce ovulation for women trying to conceive. It's important to discuss the potential benefits and risks of each medication with your doctor to determine the most appropriate treatment plan based on your individual needs and circumstances. Section 7. Surgical Interventions, Exploring Treatment Options. While lifestyle changes and medication are the primary treatment options for PCOD, surgical interventions may be considered in certain cases. These procedures are typically reserved for women who have not responded to other treatments or who are experiencing complications related to PCOD. One surgical option is ovarian drilling. This laparoscopic procedure involves using a laser or a small needle heated with electricity to create tiny holes in the ovaries. This procedure aims to reduce the production of androgens and regulate ovulation. Another surgical intervention is ovarian wedge resection, a more invasive procedure that involves removing a small portion of the ovary. While effective, this procedure is less commonly performed today due to the availability of less invasive options. In some cases, surgery may be recommended to address specific complications of PCOD, such as endometrial hyperplasia, which is the thickening of the uterine lining, or even endometrial cancer. It's important to have a thorough discussion with your doctor about the potential benefits, risks, and long-term implications of any surgical intervention before making a decision. Section 8. Living with PCOD, Long-Term Management. PCOD is a lifelong condition that requires ongoing management. While there is no cure, with the right treatment and lifestyle changes, women with PCOD can live healthy and fulfilling lives. Long-term management typically involves a combination of lifestyle modifications, medication, and regular monitoring. It's crucial to maintain a healthy weight, engage in regular physical activity, and eat a balanced diet. Regular checkups with your doctor are essential to monitor your condition, adjust medication if needed, and address any concerns or complications that may arise. It's important to remember that PCOD can impact various aspects of a woman's life, including fertility, mental health, and self-esteem. Seeking support from healthcare professionals, support groups, or therapists can provide emotional support and guidance. Living with PCOD requires a proactive approach to managing your health and well-being. By staying informed, embracing healthy habits, and seeking support when needed, you can navigate the challenges of PCOD and live a full and rewarding life. Section 9. Finding support. You are not alone. Being diagnosed with PCOD can feel overwhelming, but it's essential to remember that you're not alone. Many resources and support systems are available to help you navigate this condition and live a fulfilling life. Start by talking to your doctor. They can answer your questions, address your concerns, and provide guidance on managing your symptoms. They can also refer you to specialists, such as endocrinologists or fertility experts if needed. Consider joining a support group, either online or in person. Connecting with other women who understand what you're going through can provide invaluable emotional support, practical tips, and a sense of community. Don't hesitate to seek professional help from a therapist or counselor. They can provide coping mechanisms for dealing with the emotional and mental health challenges that can accompany PCOD, such as anxiety, depression, or body image issues. Remember, PCOD is a manageable condition. By taking charge of your health, seeking support and staying informed, you can live a happy, healthy and fulfilling life.